I'm Dr. Philip Snell, and I'm here with Dr. Clare Frank, DPT from Los Angeles, who is one of the DNS instructors here with us at API, doing the Pavel Collage's DNS program this weekend. I wanted to ask Clare a little bit about the reflex points and reflex locomotion that Václav Vojta came up with a number of years ago that Pavel Collage has also embraced. And it seems that oftentimes people, when they hear a bit about the DNS program, hear quite a bit about the reflex points and the reflex locomotion and have a sense that that might be the majority of the system. I was wondering if you could comment on where that fits into the DNS paradigm.
Okay, first of all, as you mentioned, most people think DNS is the same as reflex locomotion or the Vojta principle. I would like to address that right off the bat, that it is not. The reflex stimulation is only a small part of what the whole DNS approach is. DNS approach, if I can put it simply, is like an umbrella. It's a way of understanding the whole movement system from a developmental kinesiology perspective. And Vojta, or reflex locomotion, is a part where we can access that just as the same if I were to use ball bath techniques or some of your joint manipulations or exercise movement correction or Shirley Sarman's or Janda's techniques as a way to get to this whole approach. DNS basically just gives us it's like, I see it as like a little umbrella to help us understand developmental kinesiology.
Excellent, thank you for that. I know that you are I won't say well-grounded, but a good bit of the information that you've worked with over the years has been the work of Vladimir Janda, also
Yes.
a former head of the Prague School,
Yes.
and you were second author along with Phil Page and Robert Lardner
Yes.
on an excellent book.
Thank you.
Kudos on that, on the Janda protocol. And I believe JandaApproach.com, I think it's Phil's
Yes, I
site
believe so.
on that as well.
Mm-hmm.
I wonder if you could talk just a little bit as well about how the Janda protocols factor into the DNS program.
Janda basically emphasized when you rehab, let's say a knee or a shoulder, he's basically telling you that something is not just isolated. It actually happens in chains. And when you look at the movement, or rehab, don't focus it on elbow pain only and just treat the elbow. The source or the cause of the symptoms may actually be coming from somewhere else. Perhaps the tonic muscles, let's say the pectoral muscles, are being overactive. That will actually drive down the whole chain, which is a tonic system. And so Janda also recognized that tonic muscles, which he has described as there are a number of muscles. Empirically, he observed that certain muscles will tend to become tight, and these tightness can be in the form of muscle shortness, hypertonicity, or muscle stiffness. They are the ones that tend to become stiff, tight, or overly active, because the phasic muscles tend to become weak or inhibited. So now you have a little imbalance. And what we're trying to do is, because we know the tonic muscles tend to become very dominant, we want to try to facilitate the phasic chain. And this actually is also, if you look at how developmental kinesiology works, it actually plays a beautiful role of integrating why some muscles tend to become short and stiff. Because if you look, when I'm in pain in the shoulder, I tend to go into a little bit more protraction, adduction and pronation, and that's how and all these muscles will become overactive. So look at the pecs, look at all these muscles that become tonically more active, and when I want to facilitate it, so if I'm getting someone with an elbow tendonitis, the cause, I can treat it locally and we'll get good results. But perhaps if I can also create a chain, get the muscles to release here to get the phasic muscles to work better, then I release the tension in the elbow itself. So sometimes you don't have to treat locally. You can actually treat muscles distally, or not distally, away from the area of pain.
Excellent. That's a fabulous description of the way that I've seen this integrated in with the DNS protocols. Thank you so much, Claire. I appreciate it.
You're very welcome. Thank you.